Rochester Regional Health Information Organization is your medical records. And if you give us consent to look at them, your doctor can go in and see what medical history you have, what you've been admitted for, what tests you've had done. You don't want to have to explain everything over and over to people. You know, sometimes you might forget something. It does save time, money, to get to the bottom of things faster. When people come in, we have in our system a question right there that reminds us to ask about the RHIO. If we put a yes in the box that they've signed consent and the date and time, it actually rolls over to RHIO.
It's really simple. Username, log on, and obviously the patient, you need the patient's permission, and once that's established, it's just really a couple clicks.
Well, the nice thing about the RHIO is it really allows us to synthesize information across many health systems. So you ask the patient, do they do CTs, do they do lab work, do they do x-rays? Oftentimes the patients aren't, unfortunately, savvy enough about their own health care that they know that. I find generationally, the younger generation just assumes that you can access their records anywhere and they don't even have to remember where they had their tests done.
If a patient has been to another facility for a same issue that they're here for, we can see that. If they had already had a x-ray or ultrasound, anything done radiology-wise, we can pull up that picture. If we transfer a patient to the city, they already have our records on RHIO instead of, you know, waiting to make a copy of the CD with all the images, printing the labs out.
They don't want to do the extra step. They're worried that it may be a little more complicated than it is. Like it's another username, another password, another computer access thing we have to get used to. But it's really the simplicity of it, to me, is the beauty of it.
Do you want it on RHIO or do you want it on? It allows me to decrease the amount of imaging I use, particularly because I can access imaging results at other institutions. It allows me to decrease the amount of lab work I use. If I know what those outpatient labs were at a different facility, then I can tailor what I'm ordering here and not recreate the wheel each time.
We talk about healthcare costs, we talk about saving time, but really if RHIO is used in a proper fashion, you can really help the care of the patient, which is the ultimate goal we're trying to achieve.
I encourage the docs to get enrolled. I encourage them to look into it. I demonstrate for them how it works. And then they start getting that perception, wow, this is useful data that allows me to make better judgments that I wouldn't have had access to before.
As the system grows, there'll be data from not only around here, but throughout the region, the state. There's more and more information on that that's so helpful.